really lucky today to be joined by Charlotte McIvor, and I'm going to hand her over. And thank you for attending.
Hi everybody, thank you for coming today. Now, because I'm sharing my screen, I can't see anybody, so if there are any questions, please can I just ask that you shout up rather than put your hand up, because I can't necessarily see them. You'll be pleased to hear that this is, it's down for an hour, but because it is literally the updates for this year only and some general information, I'm thinking we're probably going to be done for about half an hour. Any burning questions, please ask as we go through. Any other questions, like I say, you can pop them in the chat. I'll have to deal with those at the end when I stop sharing my screen because I won't be able to see them. So like I say, if there's anything you want to ask, please do just let me know. So we'll crack on, she says. So yeah, just some general. So this is about the pneumococcal, shingles, influenza. It does say and COVID vaccines. There are some bits in here around the COVID programme. Obviously, please, if you are doing COVID vaccinations within your primary care network, do go by the protocols and procedures that they have set up. This is just general things. So there is just a little webinar link here. This was the Nottingham flu webinar, just in case anybody didn't get the email. It is quite useful. And then a link to the Green Book chapter 19 for flu. And this is just a little bit of the things that we're going to go through today. So I'm not going to bore you with this slide. Again, it is just for general information for anybody who may have only started vaccinating recently and it's their update. But obviously, it's just a reminder about the importance of how, flu is a serious disease. It can be spread really, really easily. And just a bit about its incubation period. I sometimes find it easy to remind myself of these things, especially when I'm seeing patients every day. It helps to remind them. So, flu vaccine eligibility for this year. So it's all children aged 2 to 3 years on the 31st of August 2023. Just as a little bit of a heads up for those particularly EMIS practices or that are using Ardens, the searchers seem to be bringing up 2 to 3 years, but aren't including the from the 31st on the 31st of August part. So please do just check that they're actually eligible. All primary school age children from reception to year 6, obviously that's done by the school nursing team, but you may find some booked in if they've missed it on that day. And then secondary school children 7 to 11, again, you may see some on your list if they weren't at school on that day. So we're commencing vaccinations. Obviously, the flu delivery has now happened, and we're hopeful to be completed by the 15th of December for all school-age children. For those aged 6 months to under 65 in clinical risk groups or pregnant women, as we know, I know we really struggle in the city around pregnant women. Please do contact your midwives or health visitors if you're struggling. We are trying to work in partnership with them this year to ensure that we make sure that all pregnant women have had their flu and COVID vaccinations. Those aged 65 and over, those living in long stay residential care homes, and includes other long stay care facilities. Sorry, I'm skipping ahead of myself. You will also find that you may get asked to do university halls of residence if you do the outreach sort of clinics, but they are also able to have them this year. Frontline staff employed by social care, again, check with your employer as to where they want you to have those vaccinations. Some like us to go to like Boots with a voucher, some are happy to do it in practice. Please just make sure that that's been checked. On our next slide here, we have the flu vaccines that are available this year. Obviously, like I say, the majority have now been delivered, but you can see you have got your egg-free varieties for those who have egg allergies. And obviously remembering that the nasal flu is a live vaccine, so any children that are immunocompromised, we just have to make sure that we offer them an alternative. Is it okay? I'm not going too fast for anybody. Is this all right? Like I say, I can't see anybody. Okay, lovely. No complaints. I'll continue. So So this is again just some key messages to support you with this year's campaign around COVID and flu. Like I say, it's not something that I'm going to sit and read out to you, but it will be quite beneficial just to have a read through, so that if patients ask you questions or you have any queries about the key messages, they're there. One of the major changes is around the Shingles programme this year. Obviously, we used to use Zostavax. That has now been replaced fully by Shingrix. There may be some... Oh, sorry, I'm just getting a bit of feedback. Are we all right to mute everybody? Lovely, thank you. So yeah, it's a... You may have some Zostavax left in the surgery, that's fine to use, just remembering that we have a different schedule for that, and that's on a coming slide. Shingrix is obviously a 2-dose schedule for all cohorts, as mentioned there. And you've got chapter 28A in the green book. Now, if I just move on here, this is a little bit clearer for you. So the replacement Zostavax with the 2-dose Shingrix. You don't have to revaccinate patients who've already had Zostavax. I know in general practice I've had a few patients coming back saying I've been told I need to be revaccinated. No, don't need to. Obviously, immunocompromised cohort, individuals over 50, no upper age limit, and they can have a dosage between 8 and 26 weeks. And again, there's just a little bit of an easier delivery schedule there for you. These are the SNOMED codes. I've left the Zostavax ones on there just in case anybody has any left in stock. But obviously you've got your Shingrix first dose, second dose, and then you require shingles vaccination. So that's that there. Just something that I didn't add on there actually is just remembering that obviously the shingles vaccine, we have to be very careful if people are living with immunocompromised individuals. So please just make sure that we check that before administration. Sometimes we can overlook that. I'm guilty of it myself. The pneumococcal vaccination, still just as important as it has been over any other year. It's for people aged 65 and over at high risk because they have long-term health conditions. Again, just a little bit of information there. I know I'm preaching to the choir, you guys know all of this, but just in case you've got anybody new to practice or that needs this information. Again, you know, we saw massive flu deaths last year. People were declining the flu vaccination for a variety of reasons. A lot of the research suggested it was around the fact they'd had the COVID vaccination, so they thought they didn't need their flu vaccination. So it's making sure that we are sort of encouraging our patients to have flu and COVID, especially if they've got high risk conditions such as respiratory conditions, diabetes, etc. Co-administration of vaccines. So the shingles vaccine can now be co-administered with COVID and influenza. I mean, bless them, they're going to be like a pincushion. But obviously, as you know, not in the same place. So 2 in one arm, 1 in the other. Patients can also opt to come back and have separate appointments. So they don't have to have them all at once, but we can co-administer them. So there are a few other bits to add, but I just want to check, is there any questions at this point or anything that anyone's not sure about? Nope, okay, fair enough. So there's at the bottom of this, there's some useful links and guidance. It looks like there's a lot there. Obviously, keep an eye, the green book changes regularly, as you know. I've put the patient route directive templates on there for any staff you work with that are going to be doing flu and don't use the online systems. Any sort of online, any East Midlands flu queries, this is who to contact. And obviously, if you've got any questions for me, let me know. I'm just going to stop, but I'm just going to turn this one off because I just wanted to know if you guys were aware or use these. So particularly around, this is around child IMS, but this is the immunisation schedules for other countries versus us. So obviously, let me just click on, she says, I'll scroll up, here we go. So yeah, basically it tells you what their list of that country and when they vaccinate in comparison to when we vaccinate. I just find it particularly interesting, because it helps support me when we have people from other countries that say, oh, I've had that vaccination, or oh yeah, I'm you know, I've had that, but I've had it at a different time. And it's got the majority of the countries we see. Obviously you've got your sort of Eastern European countries down here, Poland, etc. Like I say, it just helps support you in terms of that. And then you'll just have to excuse me. The Shingles eligibility calculator again, I'm sure you're all perfectly well aware of it, but sometimes in a busy clinic, it saves me having to work things out. So you can put in your patient's date of birth, when you're offering the vaccination, if they're immunocompromised as per the Green Book, and what their age is, and it'll tell you if and when they're eligible and when they can have their vaccine. And like I say, these are all available. I can quite happily attach those to the slides. So again, I'm gonna have to like see you guys. I'm just gonna stop sharing my screen a second. So hard when you feel like you're talking to yourself. So, does anybody have sort of any burning questions? Anything that they're thinking, actually, I didn't know that, or I want to know? Any sort of like takeaway points that you want me to update you with in terms of the immunisation programme? Haha, thank you, Rachel.
Just a minute. I'm coming. I'm on my way. Hi. How are you, Charlotte?
Hello.
You're right.
Yes, are you?
Yeah, sorry. I'm kind of being a bit of an imposter here. I'm
That's fine.
using this platform just as a quick hello to any of the nurses that might have joined today. I can see there's a few on there. Just as an introduction, really. I know I've sent emails out. Well, email. Apologies. As an introduction, but yeah. This is me. So I'm Rachel. I'm the new lead nurse for Nottingham City General Practice Nurses, and hopefully I'll get to meet all of you very soon.
Yeah,
thank you for letting me just
yeah, no, it's fantastic to have you here, Rachel. Thank you. It's really,
awesome.
really good that we've finally got somebody representing the city. We're very excited. So I really hope that all the nurses, you know, sorry, because that distracted me. Really hope the nurses do get in contact with you, because obviously we want to build that really strong relationship. It'll be really good.
Thank you, Charlotte.
So I've got some things in the chat. So let's have a look. Is there any guidance on vaccinating each other in practice, re-staff? So obviously, like I say, in terms of vaccinating practice, you need to check with what your practice policies are. Some practices are happy for you to use their stock and vaccinate. Others aren't and would rather that you went to other places. However, in terms of vaccinating each other, it's exactly the same as if it was a patient. As long as you've got that person's consent and you are suitably qualified to provide that vaccine, then there's no reason that you can't vaccinate other staff. But like I say, you have to make sure that you've got that consent, and obviously it's recorded afterwards. And that's a big one, particularly if that staff member isn't registered with your GP practice. You have to give them the information of the vaccine so that they can let their GP surgery know. Hopefully that answered that one. Not a problem. Any other sort of questions, queries, concerns around immunisations? I know there's been sort of a lot of changes since COVID, and are any of the PCNs that are on this call doing the COVID vaccinations this year?
We are in Pegworth.
Ah, lovely. And like I say, Rachel, you'll have your own local guidance around sort of the PCN administration of those. But I will send some links out with the centralised guidance as well for you.
Thank you. Charlotte, I've got a quick question, if that's okay.
Go for it.
So recently I read the update in the Green Book about when the Shingles programme changed to Shingrix.
Yeah.
And I think it still says the same, but I'm not 100% certain because I haven't looked in the last week. But it was suggesting that the over 65 adjuvanted flu shouldn't routinely be co-administered with a COVID vaccine. Sorry, Shingrix and adjuvanted flu should not be co-administered, and ideally there should be a 7-day waiting period in between. Did you know about that? Is it something that's actually true? Have I made it up?
No, you haven't made it up. It was in there. They have taken it out at the moment. I think in terms of encouraging vaccine uptake, personally, you know, I think I would be a little bit cautious in terms of giving those vaccines together. Definitely, certainly not in the same arm, because obviously they are very clinically vulnerable patients. But like I say, it has now been amended in the Green Book. I will recheck just to make sure they haven't had an amendment since I did this presentation. But I will check on that for you, Rachel, just definitely to make sure.
Well, thank you,
Thank
Charlotte.
you very
I don't
much for
think
bringing.
it'll be a problem, but you know, just in case, because we do weekend flu clinics and we just do flu, but for those that are coming for Shingrix and then say, oh, while I'm here, could I have my flu? You know how it is. So I just wanted to clarify. So any information that you can get would be great. Thank you.
Yeah, not a problem. Like I say, it has been changed a number of times.
Yeah.
So like I say, just for clarification, I will double check that for you and I'll send it out with the slides for this. The only other thing is, because it's a question I had the other day, was if somebody has had shingles within the last 12 months, can we administer the shingles vaccination? And the answer is now yes, we can. Obviously before we had to wait 12 months post active shingles, but now we can give it within the 12-month period of having that, but it has to be over 3 months. Lovely. Any other questions or queries? So this is why we love updates, because you guys get a lot of your lunchtime back and I can send out the additional bits for you. If you do have any questions about what's on the slides, or if you have any particular sort of like, oh, hang on a minute, I'm not sure about that, please do feel free to just drop me an email, or, you know, send a message. It's not a problem. Oh, screen's changed. I appreciate things are changing all the time as well with immunisations. If I do see of any updates, I'll make sure that those get sent out. Sadly, they do change them during the immunisation process as well. Like I say, the slides that are in there that are just for information, didn't want to bore you with. I know you guys know the information, but I will still send those out so that you can support any nurses that are new to practice or need any support in terms of the flu programme. So, I mean, that was a whistle-stop update, which was quite good. But any other questions, anything that anybody's got for me before we end the recording? Lovely. Denise, are you still on the call?
I am indeed.
Lovely. So if it's all right for you, if you're all right to stop the recording for me, I'll make sure that I send it out, and any other additional bits for anybody. But any questions, please do get in touch.